So to get started, there are a variety of reasons why we would start an IV on somebody. First of all, it may be because there's some IV fluids that the physician or the primary care provider has ordered. Sometimes and often in long-term care, it's because we need to administer intermittent medications through the IV line. So somebody's got a piggyback or, an intermittent infusion that needs to go. Now, one thing to keep in mind is when you're using the IV just to administer medications, keep in mind that you do need to track that every 8 hours at a minimum, it should be flushed with 2 or 3 milliliters of normal saline or whatever your institution says. But if they're not flushed regularly, the peripheral IV will clot and it will no longer be usable. So it is important to keep that in mind. The terminology that you may be used to hearing with an IV, such as the one that's showing on the screen here, is a HEP lock or a saline lock. And we used to call it a HEP lock because we would flush them with heparin. These days, often facilities will just use saline. So you'll hear those two terms kind of used interchangeably still. Sometimes you have a line in place just so that you can collect blood specimens. And then there are times that they're put in just so that diagnostic tests can be done. So, for example, your nuclear medicine tests, you'll see that an IV will have to be started just for that purpose.
Mm-hmm.